Welcome back to Outnumbered. Veterans Affairs Secretary Robert McDonald making a public apology for the first time since admitting he lied about his military service, claiming he was a Special Forces member. The initial comment was caught on camera during a news report while he was talking to a homeless veteran last month. Listen to his explanation of that exchange.
I asked the man where he had served in the military. He responded that he had served in Special Forces, and in an attempt to connect with that veteran to make him feel comfortable, I incorrectly stated that I too had been in Special Forces. That was wrong, and I have no excuse. We at VA are working hard to restore trust, and again I apologize to those who may have been offended by my misstatement.
This coming after Secretary McDonald had already come under fire for saying in another news report that 60 people were fired for their part in the VA wait time scandals, when in fact a fact-checking website, the Washington Post, gave him 4 Pinocchios because they found that only a handful had actually been dismissed after the Phoenix VA scandal and the scandal that was released last month. He used a word, Harris, trust, which I'm glad he owned up to it. You know, we haven't called for him to step down, but it really erodes trust when you're trying to repair an agency and you're not telling the truth.
He used another word, working, because if he were working on keeping that trust, this might not have happened. You know, up close and personal, I got to see how some of the systems at the VA work when my father, the colonel, fell very ill a few years ago. And that's really what matters here. Like the semantics of this and where he thinks he should be, and you know, and Democrats and Republicans saying we should focus on what needs to happen at the VA. This conversation is so below where we need to be. Our veterans should be our focus right now. And if he becomes a distraction, then let's move on, because we can't take any distractions. You're a veteran. What's important?
Well, what's important is fixing a fundamentally dysfunctional organization, a bureaucracy of 300,000 that still can't deliver basic, timely health care to veterans.
And 20 were fired. Out of 300,000, 20 people were fired.
That's right. And how does that strike you? Here you see a scandal, and then you see actually less people being fired under McDonald than the previous VA Secretary in Shinseki. What does that tell you about the culture? It
tells me that veterans are not being served. I mean, it's like, you know, we have the conversation about schools and choice. Learning is the most important thing, and here veterans are the most important thing. And when it comes to choice, they're not exactly getting that. I asked your colleague Dan Caldwell last night, what's the most important thing? What are veterans saying to you? What are they looking for? What's the one thing they want? And that's a choice in health care. And the VA is so broken, it's so fractured, that is the last thing to be addressed, unfortunately, when we talk about it.
You're working on something right now.
Well, funny you should mention choice. Shameless plug alert, but my organization tomorrow is doing a bipartisan Fixing Veterans Health Care Task Force. We're releasing a 100-page report that will fundamentally transform the VA. It's bipartisan, working with Bill Frist and a Blue Dog Democrat, a number of other people involved in health care, to put the veteran at the center of their health care. Give a veteran a choice. Hold the VA accountable so they have to compete for veterans as customers, not just take them for granted. These are familiar themes, Andrea. This is the type of thing government needs.
And we've talked about this before, Pete. Republicans and Democrats on Capitol Hill are both at fault here with the VA.
That's right.
I mean, they sit behind in these closed-door meetings. It's all about money. Then on the surface there, we care about the veterans, but there's no motivation for these hospitals to do better because, as you point out, there's no choice in competition. There should be vouchers for veterans to be able to go to different hospitals, or like they get Wall Street money to fund charter schools. Why not get some Wall Street money or get money for veterans' hospitals?
That's a fantastic idea.
I think that would be a great idea.
That's the first time someone has suggested maybe having a privatized element and an infusion of private money into the veterans.
Well, very quickly, Pete, I want to ask you, though, you talk to veterans every day. What are they saying about the head of the VA lying about his service? Because, I mean, I can get upset about it, but really it's the veterans. What they care matters most.
Frustrated. The American Legion came out with a very strong statement saying you can't be setting an example by lying about your service record. They use that word, not us. But there's general frustration that he could become a distraction. What they want are real solutions and real options. And if that was the first time that choice was suggested, then this report is the second. And I think legislators, they're listening to veterans. We commissioned a poll. 90% of veterans want a choice in their health care. They want the ability to go outside the system if they're not being served well. That's what we should give them. So thanks for indulging me, ladies, on that.